On behalf of Vaccinate Your Family and the American College of Obstetricians and Gynecologists, welcome. Please feel free to ask questions in the comments and we'll try to get to as many as we can. And while you're here, please like or follow Vaccinate Your Family and ACOG on Facebook and share this video with your communities. So again, my name is Zenobia Moss and I have the pleasure of serving as your moderator today. I am CEO and managing partner of Moss Consulting and Management Group, and we design and implement and execute large scalable cross-sector initiatives in various sections, including healthcare, nonprofits, childcare, education, and policy. But enough about me. Let's get to our real celebrity of the day. We are so excited, and I have the pleasure of introducing Dr. Riley, who is with us today. We're so excited. Dr. Laura Riley is an obstetrician and gynecologist in chief at NewYork-Presbyterian Weill Cornell Medical Center and chair of the Department of Obstetrics and Gynecology at Weill Cornell Medicine. A maternal fetal medicine specialist and internationally recognized expert on obstetric infectious diseases, Dr. Riley specializes in the treatment of expecting mothers whose pregnancies are high risk because of chronic illness or infectious diseases. She is the chair of ACOG's Immunization, Infectious Disease, and Public Health Preparedness Expert Work Group, and a member of ACOG's COVID-19 Work Group and author on ACOG's COVID-19 Guidance. She also works with the CDC, the U.S. Department of Health and Human Services, and ACOG to develop practice guidelines for the care of pregnant women with Group B strep, Ebola, Zika, influenza, and COVID-19, as well as maternal immunization. Welcome, 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 Dr. Riley, and thank you so much for being here with us today.
It is my pleasure.
So today we are going to just have a wonderful conversation with her. And again, feel free to put information into the chat so that we can engage you all to be a part of this conversation. So our discussion topics are going to range around 3 topics: COVID-19 vaccines, flu and Tdap vaccines during pregnancy, and also where are the resources and information, or where do we go from here? So we're just going to begin, Dr. Riley. If you're pregnant or could be soon or breastfeeding, what should you be thinking about when considering getting vaccinated against COVID-19?
So I think the first thing I would say is let's sort of separate those things a little bit, because I think that, for an individual woman making a decision, sort of someone who is not pregnant, considering pregnancy or going through infertility, we would strongly recommend that that woman get vaccinated, right? Protect yourself from COVID-19. Mm-hmm. In pregnancy, the recommendation is really quite the same in the sense that we want women to know that COVID-19 infection in pregnancy can be particularly harmful. I think what we've learned over the last 15 months of this, scary epidemic is that pregnant women are more likely to have an ICU admission, need a ventilator, even the risk of death is higher. We've also seen over the course of the last 15 months that there seems to be an increased risk of prematurity for women who get COVID-19. Maybe more women get preeclampsia. I think that's still, a question. And then there's some studies suggesting that more women will get cesarean deliveries. I think at the end of the day, even though if we, look at any of those individual things, I think at the end of the day, it's clear that COVID-19 in pregnancy is way worse than in the non-pregnant state. Because of that, we also know, though, that the COVID vaccines are our best prevention against getting sick with COVID-19. So I think with pregnancy, the issue is, the disease is worse. I think that the benefit of the vaccine outweighs any of the potential risks. But I know that that's a tough decision for some women to make. Yet that's the recommendation. It is available. Women should strongly consider taking it and go from there. Then the third group of women, those who are breastfeeding, I think that's a slam dunk. Take the vaccine, protect yourself. If you've managed to get through pregnancy unscathed, awesome, good for you. But get the vaccine as soon as you possibly can after you deliver. There's no live virus in this vaccine that you should feel as though you're potentially giving it to your child through breastfeeding. None of that exists. And I would actually remind women that we suggest and give MMR, which is a live vaccine, the minute you're walking out of the hospital with your newborn. So even if you're breastfeeding. So again, no reason not to get it. It is the best form of protection against the disease and against transmitting it to the rest of your family. So when grandma comes to visit your newborn, you don't need to be giving her COVID-19.
Oh, thank you so much for that information and talking about the benefits of the vaccine. Another question is, what can you tell us about how well do the vaccines work? And what about against the variants?
Yeah. So I think, one of the things that happened at the beginning right when the vaccines were made available, I think a lot of patients were like, how do you know this is even going to work? And honestly, in the clinical trials, we knew that the vaccine would prevent you from severe illness and hospitalization. We didn't know that much about transmission. We were hoping that it would decrease transmission. I think now that the vaccines have been out and available, there's very good data to suggest that it also prevents transmission. So that's number one. There's no data that suggests that the efficacy, I should say, of the vaccine is any different in pregnancy versus non-pregnant individuals. So the same way it protects non-pregnant individuals, it's protecting pregnant women from getting COVID-19. So that's more information as well. And then the variants. So, the variants is an interesting story. The variant that is now circulating in Brazil is particularly scary because what they're seeing is that it seems to be more infectious than what we were seeing in the US. And then also it seems to be associated with a greater case fatality rate for pregnant women. So that means, way more morbidity and deaths associated with COVID with this new variant. The good news is that the vaccines that are available to us in the US are very effective against that new variant. So, so far so good. But again, how effective it's going to be does depend on a lot on how many people get vaccinated. So the closer we get to the ideal state of, 70, 80% of the population being vaccinated, the better off we'll be against those variants.
Wow, thank you for that. Another question is, do the vaccines pass on protection to the babies in utero or while breastfeeding?
Yeah, so that's a great question. There's currently data now, including our institution, which shows that pregnant women who get vaccinated against COVID-19, during pregnancy, do pass those antibodies that they make to the vaccine. Those antibodies get transmitted into the baby because we can measure it in cord blood, and that's awesome. What we don't know is how much of those antibodies are then protective for the baby after. We don't know how long those antibodies last. I think if it works analogous to other vaccines that we use during pregnancy, like flu vaccine or Tdap, the whooping cough vaccine, if it works like those, you boost mom's antibody response to whooping cough. Let's use that as an example. And then those antibodies cross the placenta and are in the baby's system for several months after delivery. And it's those antibodies that are absolutely critical that prevent the baby from getting whooping cough in the first few months of life, when babies were dying at a high rate if they in fact got whooping cough and didn't have that protection from mom. So assuming the COVID vaccine works in the same way, it should prevent, baby newborns from who become exposed to COVID-19 from getting infected. Mm-hmm. That's our hope. I think the fact that we found the antibodies in the cord blood is very exciting. More work is being done, obviously, on larger populations, but I think also more work is being done to see what kind of protection women who are breastfeeding also can afford to their babies. Do those antibodies, appear in breast milk in enough of a way to protect babies? So, obviously, breast milk has lots of benefits, but wouldn't it be nice if this was yet another benefit?
Thank you. Well, I'm so excited to have this opportunity to also work with Vaccinate Your Family on a major initiative called Good Health Wins with the National Council of Negro Women. And we are building this army of immunization advocates. And as we're preparing our advocates to go out and share the word about the importance of vaccines, we do see the ability and opportunity for us to build vaccine confidence, especially when it comes to maternal health and COVID. One of the questions that we see often is around the safety of the COVID vaccines, especially if you're pregnant or breastfeeding. And one of the questions we would have is, does the vaccine appear to be safe for babies in utero? What about for newborns and for those who are breastfed?
Yeah, so what we know about the safety of the COVID vaccines now is a lot more than we knew at the beginning, right? So when the vaccines first came out, everyone knows pregnant women were not part of the original clinical trials. Okay. However, the safety data that we had included animal data, animal reproductive data, which basically showed that there was no adverse effects of the vaccine on developing pups or whatever, mice pups or whatever they were. And so that's important information. The second piece of information that we had at the time was that biologically, the way the vaccine worked, there was nothing about that mechanism, if you will, that should cause harm for either a developing fetus or a newborn. So those were two pieces of information that we went forward with to make a recommendation. Yes, pregnant women should strongly consider it, given all the badness associated with COVID infection and pregnancy. Okay. Now, over the last 15 months, over 100,000 women, pregnant women, I should say, have been vaccinated against COVID-19. And we have some safety data available from those women who then join a registry, a pregnancy registry, specifically on COVID vaccines, which is wonderful. Thank you to all of those women, because they really have made a huge difference in everyone's lives, I should say. So from those, the preliminary data, at least that has been published from that registry, there does not appear to be any safety issues with the vaccine in terms of, not an increased risk of miscarriage, which is obviously something that, would be very concerning to women, not an increased risk of congenital malformations, i.e. birth defects, not seen. There has not been an increased risk of preterm birth or other pregnancy sort of, complications that, you would worry about. So that's huge. And as an obstetrician gynecologist, sort of suggesting to my patients, you need to seriously consider this. I am so happy to see that safety data. I wasn't concerned based on what we knew preliminarily, but it's a whole lot nicer to now see data in a large group of humans so that we can say, gee, we're not seeing anything different. That same registry data also suggested that the side effects, well-known side effects that one would, expect from the vaccine is not different than what was seen, is not different in pregnancy, I should say, than what was seen in non-pregnant individuals. So, the same sore arm, the fatigue, a few women get fever. More of those side effects seem to be after the second shot for women who got the mRNA vaccine. So I think that that's all good news, is to know that essentially the vaccine's working the same way we would have anticipated and is working the way it's working in the general population.
That is really good news. Do you recommend one vaccine over another for pregnant breastfeeding patients?
So if they're breastfeeding, so the interesting thing with breastfeeding, I think the issue is that people are worried about the J&J vaccine, because there was that, short pause. And the short pause was because there was seen in a very tiny number of patients, but seen nonetheless, as a syndrome, if you will, of blood clotting in the brain or blood clotting in the abdomen in a weird spot, that was particularly associated with having low platelets as well. And it was really it's a scary, disease, but has a specific treatment. Mm-hmm. And I think that, when that, signal was seen, people were like, oh, I don't want to get, that vaccine. I think because one of the presenting symptoms is headache, I have said to my patients, if you have an alternative, if you can do the mRNA immediately after delivery, then take that. If there's no alternative, the only other thing you can do, the best thing for you is J&J, then go get the J&J, because it's better to be vaccinated with something than nothing. The only reason I sort of say there might be a little bit of a preference for the mRNA for some women is because if you already, postpartum, you're like headache, you got a headache every day, it's fatigue, it's preeclampsia, it's, any number of things. There could be like a number of people running into the emergency room thinking it's, something related to their COVID vaccine, and it's not. But I think at the end of the day, the most important thing is get vaccinated with something, with whatever's available to you. Given the choice, would some women take mRNA over, J&J? Yep, and that's okay. All right. Lucky for us in the United States that we have a choice. That's what I would say.
Thank you. And that important message that you said is get something, which is really important. We have lots of questions coming to us in the chat. So again, if you have information or if you have a question, please put it in the chat. We're going to try to get to as many as we can. We're so excited to have Dr. Riley with us. Here's a question from the chat. One of the major concerns I have been hearing from pregnant people who are resistant to getting the vaccine is surrounding premature labor and delivery. Could you speak to if there is a chance that receiving the vaccine could cause premature labor and early delivery?
Yeah, so that's a great question. The data that we have seen so far from women from that over 100,000 who have been vaccinated, a smaller group who are in the registry, there doesn't appear to be an increased risk for preterm delivery. And when you compare the number that they had in that group to sort of the background rate of preterm birth, absolutely zero difference. The one thing I would say, though, that we do know is that women who get COVID infection do have an increased risk of preterm birth. So, again, it's about preventing sort of even worse if you, in fact, get the infection itself.
All right. Thank you. If a woman is vaccinated early in pregnancy, let's say within the first trimester, are we still finding protective antibodies for the babies at birth?
That's such an awesome question. So, and my patients ask me all the time, when's the best time to get the vaccine? So I think that we have to think about the COVID vaccine the same way we think about the flu vaccine, right? So we recommend that all women who are pregnant get the flu vaccine during flu season, as soon as it becomes available. So if you're in the first trimester, you get it in the first trimester, second trimester, you get it then, third trimester, fine, you get it then. The issue is that the vaccine is being used to protect you from getting that disease, okay? Mm-hmm. An added benefit of the flu vaccine is that those antibodies that you develop against the flu do transmit through the placenta into the baby and protect the baby for some period of time after the baby's born, up until the time, and certainly up until the time the baby can get the vaccine, which is 6 months of age. With COVID vaccine, we're doing the same thing. We want to protect mom from getting infected. An added benefit will be when we find those antibodies in maternal blood, and then we can say, later, hopefully that's going to protect your baby from getting sick. The studies on how much antibody is being transmitted with COVID vaccines, those studies are being done now. Preliminarily, we do have some women who have been vaccinated in the first trimester, but the problem is that those people haven't necessarily delivered yet. Right? So I would look out for that data. Our institution is doing a study on it, a prospective study looking at, what the outcome is going to be. And there's many of those studies being done across the country. But the thing that women have to remember is that it's a little bit different than Tdap, because Tdap, you'll remember, Tdap we give around 20, sort of 26 weeks gestation. We say to people, 26, 28 weeks, get it when you get your glucose test so it doesn't get forgotten. And that's because at that time, we know you get the most robust, antibody response that then transmits to the baby and, protects the baby, as I said, from whooping cough. The issue, though, is that we're not so worried that something bad is going to happen if mom gets whooping cough. And we're really doing the protection. We're really doing the vaccine to protect the baby. So you can sort of choose the ideal time during pregnancy to do that. It's not the same with COVID. If you are now pregnant in my office, you come to me at 11 weeks gestation, you say, Dr. Riley, when's the best time to get the COVID vaccine? I'm like, today. We want to protect you from getting COVID. If you decide that you're going to wait, what I always say is, if you're going to wait till 28 weeks, you're playing a little bit of Russian roulette, right? You're banking on the fact that you're not going to get COVID between 11 and 28 weeks. Not such a good thing to bet on, in my mind.
All right, thank you. So how confident can we be that the vaccine doesn't cause long-term side effects?
So I think really what we can fall back on is, sort of how the vaccine works. There's nothing about the vaccine that makes us think it has long-term implications for both the person who got it initially and then the person who who transmits those antibodies to the baby. We just don't see biologically how that would happen, but we don't have that data. I think people have to recognize that. I can't tell you that we've seen that data. It's going to be a while. Someone said to me yesterday, well, how do I know that everything's going to be fine when my kid's 2 years old? I'm like, I can't tell you that because there aren't any 2-year-olds yet who are around there who we could study. I think it makes a great case that we should definitely follow these children for a prolonged period of time. But again, there's not anything biologically that seems, that we should be concerned about it. I mean, I think, the flip side is if you have a preterm baby because you got COVID, you are signing up definitely for a lifetime of various issues that are going to be long-term. So we have to think about that.
Thank you. Here's another question from the chat. Is there a safer or more ideal time during pregnancy to get the vaccination? I'm concerned about fever as a side effect of the second shot, especially in the first trimester, because isn't fever linked to possible birth defects?
Oh, such a great question. So everyone was like freaking out about the fever situation. So first of all, I would say the good news is that pregnant women don't seem to get a huge amount of fever. Some women will get fever. A small percentage of women will get fever after the second shot, just like, sort of in the general population, as I said. And the fever, I would just, put out there is short-lived, right? So 24, 48 hours, take Tylenol, fever goes away. Not worried about that kind of short-term fever even in the first trimester. I always, say to my patients, if you get the fever, take Tylenol. The fever will go away. I wouldn't be worried about it. And I think that data actually on fever and birth defects isn't that good, to be honest with you. It's really old data. And, some of those studies actually sort of mixed up fever with having other infections. So how do you know it wasn't the infection as opposed to the fever itself that was the real culprit? So again, though, I think the fact that the fever is so short-lived is what makes me say, you know what, just get it. Because the other thing is, having had COVID myself, let me tell you, the fever with COVID was not fast. And it didn't get better with Tylenol. So it's a totally different scenario.
So some of the work that we're doing with Vaccinate Your Family with the National Council of Negro Women, and we are really targeting the reproductive age women. And the basic question that they ask is it safe to get vaccinated if you're hoping to get pregnant in the future?
Yeah, so there's a lot of concern about fertility. And I think that all I can tell you is there's nothing biologically about this vaccine that should, mess with your fertility. And that's certainly not what I've seen. I've seen a whole lot of people who are getting pregnant. I am busier than I have been in a really long time. So yeah, so there's no data absolutely to suggest that this impacts fertility at all. And I will tell you that the experts in fertility, they have put out statement after statement after statement just to reassure people that they are on board with vaccination because they don't want pregnant women to get COVID-19. That's gonna make life really bad for some of them.
Yes, so I really wanted to say this is excellent about the COVID-19 and vaccines and pregnancy. We're very excited that we're going to be able to shift a little bit more to talk about, we're getting ready to get ready for flu season. And so let's talk a little bit about flu and Tdap vaccines during pregnancy. What other vaccinations are recommended during pregnancy and why?
Yeah, so as we talked about, flu vaccine, when flu season comes, October, November, December, we are going to be all about vaccinating women against flu. And the reason is that, we've seen during multiple pandemics, epidemics, you name it, and every year, actually, there are flu deaths. And the likelihood of dying from flu is higher if you're pregnant. If you think about it, there's, sort of the physiologic changes of pregnancy just make it harder to clear flu, and people do very poorly. So we will sort of recommend for all of our patients, the minute the flu vaccine is available, that they go ahead and get vaccinated. Tons of safety data on flu vaccine during pregnancy. Not associated with miscarriage, birth defects, you name it. So that would be number one. The second one that we suggest for all women is Tdap, which is tetanus pertussis, but really we're recommending it because we want to protect your baby against pertussis, which is the same thing as whooping cough. And there are random outbreaks of whooping cough. We know that children less than the age of 1 are at an increased risk for dying from whooping cough. And so it's super important for women to get vaccinated. And we've had the experience back in the early 2000s, we had the experience of trying to vaccinate mom, sister, grandma, partner, try and do this, sort of cocooning of the baby and try and, protect everybody. And honestly, that didn't work that well unless mom was vaccinated and actually transmitting those antibodies directly to the baby. So again, super important for newborns. The other thing I would say about flu vaccine, which I think I said earlier, is that an added benefit of the flu vaccine is we know that those antibodies are transmitted to babies and will protect the babies for the first 6 months of life while they're waiting to, while they're exposed to absolutely everybody and can't get vaccinated. So those are the two most common things that we recommend. There are other vaccines that we recommend during pregnancies, but usually it's for women who are at high risk for some particular reason, some particular health issue, or first, and I would also say that we also recommend finishing vaccine series. So if for some reason you are in the midst of getting your hepatitis vaccine, then you need to just finish that up. and get fully protected against hepatitis. That's one that I can think of off the top of my head, but there are others. Pneumococcal vaccine, depending on your, if you're a smoker and have, asthma, those you should finish whatever it is that you started or whatever is recommended. Pregnancy is not a reason to not do it.
Absolutely. So what's the cadence? Do I get the vaccine, start, the first dose, and then do flu, and then, and then do my second dose, or what would you recommend that cadence look like?
Yeah. So, my hope is that all women out there are getting vaccinated so that then you don't have to add COVID to one of your pregnancy vaccines. But for whatever reason, should that not work out, the CDC has put out guidance that you can get vaccines, multiple vaccines on the same day. So you probably really don't have to think about it too much. I think that, certainly with COVID numbers being as high as they are in some areas, I would prioritize that, right? Prioritize the thing that is most likely to get you sick, right? So if you happen, and we know that, flu will hit pockets of the US differently. So it's ideal to get your vaccine before it gets to your state or your, county or whatever it is. But I would probably prioritize that way.
Okay. So as we're still talking about the vaccine, so if a person receives the first dose prior to becoming pregnant and they've not gotten their second, how well protected are they with that one dose?
That doesn't seem to be so protective based on the data that exists in non-pregnant individuals. So I personally would not just operate based on that. I would get the second dose so that you're protected, especially because what's circulating now are these variants, right? So you want as much protection from these variants as you possibly can get, and we know that just the one-time dose is not enough if you get the mRNA vaccines.
Okay. All right. Well, another question that we have is, what is known about the safety and the benefits of those vaccines for both pregnant people and their babies? So when it comes to flu, Tdap, COVID, all of this.
Yeah. So COVID, I think we've pretty much knocked out of the park here with all the data that is available, right? And let me just say one other thing that I think is important for people to know. And my patients certainly ask me about this is, if something develops, are you going to let me know? Absolutely, right? So there is a safety technical group, which is like yet another little subgroup from the COVID vaccine work group at the CDC that is looking at data every single week from multiple safety systems that exist in the US. So the VAERS system is a passive surveillance system, which anybody, a doctor, a nurse, the patient, can write in and say, I took the vaccine and my arm got sore, or I took the vaccine, I got a high fever, or I took the vaccine and my baby was preterm. And so I want to, sort of understand that and report that in. And so anyone can do that. And that we look at that data every single week to make sure that we're not seeing things that make us think, ooh, could that be related to the vaccine or not? Most times it's not, but it's still information that needs to be had. And so that subgroup is available now and looking at safety data on a weekly basis with the COVID vaccines. I can tell you that when the flu pandemic hit in 2009, gosh, I'm old. In 2009, when there was the H1N1 epidemic and pregnant women were dying from the flu, there was this same vaccine safety technical group, and I was a member of the group then. And basically what we did was we looked at safety data that came in from all the different safety systems every single week, because people were concerned about, is there an increased risk of miscarriage? Is there an increased risk of preterm birth and things like that? And so we have that same system set up. I would say that now for flu, we've got years and years and years of safety data. We're not concerned about the safety of flu vaccine. We've got lots of safety data on pertussis as well. Nothing has ever, come about. And so far, what we've seen about COVID has been good as well. But know that we're watching. I mean, and I think that that's really important. And if there is something where we're like, there's an increased risk of this, like the CVST or whatever you want to call it, TTS, they call it a million different things, the one with the blood clotting and the low platelets associated with the J&J, there was no time wasted once people recognized that there could be something a little bit different and could it be related to the vaccine? Maybe, maybe not, but it was much more important for the public to know about it so that they would know how to best take care of themselves. And it was also important for doctors to know, right? Because the way we take care of that particular syndrome is different than the way we take care of somebody else who walks through the door with a blood clot. So that I think is really also important for people to know.
And we have one more question in the chat as we begin to wrap this up.
Sure.
Is there any way to check our cord blood for COVID antibodies when the baby is born for those of us who were vaccinated early in pregnancy?
So I don't know that you can do it sort of as a routine. If you are in a study, that's exactly what's being studied. So we may not be able to get your cord blood, but we are getting a group of women's cord blood so that we can see exactly how much antibody is in the cord blood, whether you were vaccinated in the first, second, or third trimester. So we will have, or breastfeeding, we will have that data. The breastfeeding stuff is a little harder though, because you're able to test things in breast milk, but no one really wants to stick their baby to see what kind of antibodies are in the baby. So we do have a cadre of, a small number of babies who are like okay with it, but that's a harder study to do.
All right. Well, you have been a wealth of information. And one of the things that we really value is to give people the opportunity to find information for themselves. So where would you suggest people who are pregnant or breastfeeding go to find trusted science-based information about vaccines?
Go to you guys. You guys, have done a great job of, putting out really important information. ACOG has information. So ACOG is the American College of Obstetricians and Gynecologists. And then also the CDC, the page on pregnancy and COVID vaccine is really well done, very straightforward. Here's what we know. Here's what we don't know. And then, sort of here's how you can weigh the risks and benefits. ACOG also has a nice sort of risk benefit kind of calculus that people can utilize. And I think that just talking that through with someone else, hopefully you can get to your provider if you can't, talking to nurses and other healthcare providers is also helpful. The Society for Maternal Fetal Medicine also has one of these things where you can think about the risks and these are the benefits. And really, again, just reminding people that you're thinking about things like, what's the risk of the disease itself? What happens if I get COVID? That's really what the question is. How do I prevent myself from getting COVID? Well, you know what? It is important to mask, social distance, do all of those things, but just remember people are still getting infected despite that. And so the best prevention at the end of the day is going to be COVID vaccine.
Thank you. And again, just to reiterate, if you'd like to get trusted information, science-based information, you can go to vaccinateyourfamily.org, vaccinateyourfamily.org, or ACOG.org. That's ACOG.org if you want some additional information. And of course, you can always go to the CDC. So what resources, Dr. Riley, you think are available for those pregnant or breastfeeding in the U.S. who are uninsured and or cannot afford vaccinations?
Vaccinations are free. This is not afford, not afford. This is, you should be able to walk in and get COVID vaccine wherever it's available. I think the issue is the availability. So we know that the access is not as good as it should be. Although I think that, you know, every state is making an effort to make sure that it's available. And so it may take a phone call or two. I would start with, you know, sort of the health department, because they've got to know where the vaccine is available. And certainly for pregnant women, your provider should know where it's available. A lot of us don't have it in our offices, but we know in the very, you know, close vicinity of our offices where it is. In fact, you know, some obstetrical units are actually giving, which we do, we offer vaccine on your way out the door. If you hadn't gotten it during pregnancy, you can certainly get it postpartum. So I think that there's more and more, you know, vaccine available, and people just need to ask. Just pick up the phone and ask.
All right. And I wanted to share with our listeners today that if you'd like more information about resources, you can always go to Vaccinate Your Family. They have a tremendous website, and they actually have a tool on their website regarding paying for vaccines. So use that as a resource too. Well, we are going to wrap this session up. Thank you so much for tuning in. Please share this video with your communities and like Vaccinate Your Family and ACOG if you haven't already. Vaccinate Your Family will be hosting more live Q&As as well as science-based information about vaccines during pregnancy in all stages of life. And before we leave, I would like to ask and thank Dr. Laura Riley. Are there any closing comments, words of wisdom, anything you'd like to share with the world regarding the work that you do, that you continue to make a difference to improve the lives of not just your patients, but the global community as well? So we thank you for that. Any closing comments or remarks?
I don't think so. I just hope that everyone will go ahead and get vaccinated, because we really need to move on from COVID-19. It has affected us in so many different ways, that, you know, the protection that it can give us is tremendous. And I think we just need to take advantage of it.
Well, thank you so much for that. Again, what a joy and honor it is to be able to connect with you today and to share this forum with you. And for those of you who are listening or watching, we'd love your feedback. Please take a minute to fill out a very brief survey about this video, and we'll post a link in the comments. Thank you, everybody, for participating, and I ask that you will stay safe and be well.